If you're with someone who has histrionic personality disorder, it can almost mimic signs of narcissism. In fact, many people say they're with a narcissistic person, but when I meet the couple, then I realize it's not really narcissism. What is histrionic personality? It's more of an extreme attention-getting behavior. A person that needs drama, a person that needs attention all the time. And because of this need, they often sap the energy out of all kinds of relationships, including with their significant other. There are couples who can make it work with a partner with histrionic personality disorder. But I think the most important thing is you understand what it is. It's a real diagnosis in the DSM-5 revised, and it's also part of this B cluster where narcissistic, borderline personality disorder is, antisocial personality disorder, all of these various personality disorders, which basically means they're hard to treat, they're hard to cure. Personality does not go away. Although when individuals are very motivated, they can change and they can work with it. I'm not saying they're ever going to be without this part of their personality, but they can learn what parts of it trigger their partner. They can actually work to minimize those, but it's a lot of control on their part. And when their partner understands what it is, it really helps a lot. So how do you know if your partner has this disorder? Well, they're attention seeking all the time, not just sometimes, all the time. They are approval seeking, so they want to be liked. They're exaggerated, they're overly dramatic, they're charming, they're manipulative. They can be. They're not always that way. That makes it look more like narcissism. They dress provocatively. They're inappropriate many times with what they say. And once again, these are all things that everybody does a little bit sometimes. But when it's constant, that's when it becomes histrionic personality disorder. They love just having the limelight. They need to hog it. They need all of it. They're sensitive to criticism, and they also are very shallow. Like, when you talk to them, it's pretty superficial. It's on the surface. Now, that doesn't mean they don't have deeper feelings about things, but it takes a lot of work to get to that. Like, that's not how they daily function. But obviously, for people who are in love with them, they can see that deeper part. They've been able to appreciate that, and maybe their partner is opened up to them enough so that they can see it. So what causes it? We don't really know what causes it. It's a genetic, many times, environment. If you grew up in a chaotic family where you saw this happen with a parent, it was modeled then, maybe genetic too. It also correlates with abusive relationships, abusive families, families where there was lots of stuff going on, you know, a lot of neglect, a lot of avoidant, a lot of trauma. We know those actually contribute to a person having histrionic personality disorder. So what if you're with this person? What if you're in a relationship with them, or they're a family member, or a friend that you're trying to understand, but their life is so chaotic and they're just sapping the energy out of everything because it's always about them? Well, the first thing you need to do is you need to get educated. Go online, talk to a therapist. When you put in histrionic personality disorder, you're going to see a lot of different things. You're going to get a lot of resources. Attend some of those. There's support groups for the partners or the family members of someone with a personality disorder like this, and you can certainly get involved that way. The more you know about it, the more you can work with it so it doesn't frustrate you and steal your joy. Secondly, although it's really difficult, I think it's important that you understand you can do couples therapy. I see couples that have this, that struggle with this. Now, granted, most of the couples I see, they're minimal, like it's modest effects. It's not severe. When it's severe, most of the time, they won't go to therapy. And also, what works good in couples therapy is they will go if they think it's going to help you, their partner. So if you present it that way, listen, I think we need this, I think I need this, then oftentimes if you're with a histrionic personality disorder person, they will go. So that's a part where they're different than a narcissist. They will go in a way to help you, but they will also manipulate you, although it's usually not to the degree that a narcissistic person would be. Make time to be all, or to have the light shine on you. So many of my clients that are with someone with this personality disorder, they actually schedule one-on-one time with friends, with family members, with work people, because they need their own light to shine on them. When you're with a person with histrionic personality disorder, you will have no light. Like basically, they take it all. They cannot stand to see another person get praised. They take that very personally. So that happens even if you, the partner, are getting praised for something. So in order for you to still advocate for yourself and feel good about yourself with all that you achieve, it's important that you schedule time away from your partner so that you can get some of that spotlight. You deservingly, really, you deserve to get it, and it's yours. So you need to schedule that. I think advocating for self is one of the most important things if you're going to be in a relationship with one of these people, or you have a family member that has this. It will help you become more loving, more empathic, and less resentful, which happens so many times and actually deteriorates relationships with people who have hysteria in their personality disorder. And I think it's also important that you have time when you can talk to a therapist one-on-one, so that that therapist can guide you. That therapist is going to help you make better decisions going forward. And also, that therapist is going to help you decide when it's too much. Because unfortunately, a lot of couples, when they get together, they're dating, they don't realize their partner has this. If you haven't been around a lot of, some of the histrionic personality disorder people will actually tell me, well, I'm Latino, or I'm Italian, or I'm, they'll use their ethnic as part of the reason they're like this. But don't be fooled. No one culture is histrionic personality disorder. They're just not. So sometimes what happens is it's important for you as part of self-care that you take care of yourself and you end this relationship. If you have children, I would really hope that you would work to co-parent those children, to be there for those children. But if you're single and you're dating and you happen to date one of these people, it's probably very important that you see up front what would happen in the event you went long-term with this person, and you talk to your partner about this. Like, will you get help? Can we go to therapy together? When they're open to it, when they can see, sometimes they do have the objectivity to see what's happening. Oftentimes, though, they're so worried about criticism that they cover it up and they deny it. So when you get them in one of those lucid points, it's important then that you see a therapist and talk this over before you make a long-term commitment plan. If this video is helpful for you, please subscribe. And if you're already a subscriber, thank you so much.